Hope you're all doing well. I am making this live, or I came on this live to discuss about your options for delivery. So your options for birthplace for your delivery. So in terms of choosing where to give birth. Okay, so you've got normally you have 3 different locations that you can choose to give birth, and sorry about that, I'm making some lunch as well. So when you are thinking of where to give birth, you will have 3 options, such as your hospital of where you're booked to give birth. You can also choose to have a home birth, or you can choose to have a birth center delivery. So there are differences between all these 3 areas, and as long as you are low risk with no risk factors that your doctors are worried about that will prevent you from having either a home birth or a birth center, then these options are available to you. So if you are considered low risk, you are considered that your pregnancy is going really well, really smooth, no concerns, no worries at all, then you will be considered as a low risk pregnancy. And at some point, let's say I'm talking in regards to things to be done in the United Kingdom. So by the time you get to 34 weeks, your midwife will be asking you where you would like to give birth. And you will have 3 options, whether you want to give birth in a delivery suite, which is based in a hospital with doctors around you, and of course midwives as well, or you will have the option to go for a home birth, which is where you're going to have your baby at your home, where the midwives will come to you. Okay, so this is a planned birth at home. I'm not talking about unplanned. So a home birth where it's planned, your midwives will normally come and see you and do your antenatal care in your home. And you will be assessed that your home is suitable for you to have it at home. And they will say, yes, your home is suitable. Your midwife will be coming to do all your appointments at home with you. And they will make sure that everything is set for you to have your home birth. Normally, people who choose to have a home birth may also choose to rent either a pool, which is a birthing pool that you can rent to keep in your home and to make sure that it is suitable. Thank you for joining the live. You know, they will say if you like to have a water birth, you may either rent or you can choose to buy a birthing pool. In terms of choosing to have a home birth, you know, it's important for you to also know that when it comes to pain relief for your labor, it's also slightly different to give birth at home. So if you are choosing to have a home birth, you must know that you will not be able to have a pain relief like an epidural. Okay, epidural are not given at home, as it is a medication that needs to be, you need to be observed, you need to be monitored when it is given to you. And you will also need to have an anesthetist to be able to site your epidural and to be able to administer the epidural. So if you're choosing to have a home birth, the pain management that you're going to have in a home birth is slightly different to what you could have if you were having your baby in a hospital. Okay, so for home birth, your midwives will, hello there, thanks for joining the live. If you're having a home birth, for pain relief, your midwives will bring a gas and air cylinder to your home ahead of time. And also, if you wanted to use the pool for pain relief, they will tell you how to set it up, or you would already figured out from the instructions on how to set up your, sorry about that, on how to set up your birthing pool and what to do in terms of getting yourself into your birthing pool for pain relief. Okay, so at home, your pain relief that you have on offer will be your You will have your gas and air for pain. You will also have your water for pain. And of course, if you've seen from my other videos, you can also rent what is called a TENS machine, which you can use to help you to maintain and to minimize pain during your labor at home. So please make sure that if you are thinking of having a home birth, you plan this ahead of time. You let your birth care, either your midwife or your doctors know that you would like to have a home birth well in advance so that you can get yourself prepared. You will have all the information you need in order to set up properly at home. Okay, so please make sure that if you are planning to have a home birth, you are prepared, you are ready, you've done your research, and everybody around you knows this is what you're doing. So when it comes to pain relief, you use gas and air at home, you can use a TENS machine at home, you can use a pool at home. If you don't plan or you don't end up buying a birthing pool and you have a bathtub, you can also have a water bath in your own bathtub in the house. So you don't need to have a birthing pool in order for you to have a home birth. You can also even deliver your baby just in your living room. It doesn't have to be in a pool. We'll call this a land birth. Okay, so you're not in water, you're on land. So you can have your baby in the house, in your, we've had women who deliver in their bedrooms. Your midwife ahead of time will bring into your home things to cover your floors, to make sure that everything is protected. It's not going to be a huge, mess or anything like that, but they will need to protect your floors. They'll need to make sure that you've moved things out of the way so nothing gets messed up or nothing gets trashed. We don't want to leave your home and you've got, blood or you have any sort of evidence of the delivery in your living room or in your bedroom or in your home. So midwives would definitely do their best to keep any mess to a minimum. And we do clean up before we leave your home as well at the end of the delivery. So a home birth is really nice. It's very, very relaxing, very calming. And also, if you have other children who you are concerned with them, being looked after by somebody else, or you're not sure who is there to watch them, or, you don't have anybody around you to take care of them except for maybe relying on friends, and you're not sure if they're going to be there for the time you need them, then a home birth will be a really, really good option for you to choose to have your baby at home, where you don't need to worry about childcare. If you have pets as well, some people choose to have a home birth because, maybe it's a bit difficult to get somebody to watch your dog or your cat or whatever pets that you have, that you may feel like you would rather be home to do the delivery. And of course, you can just generally just want to have a home birth because it fits your preferences better or is more in line with your beliefs and your faith, and you would rather do your delivery at home. So if you would like to have a home birth, as long as you are low risk, as I said, you are more than happy to explore this and tell your care providers that this is what you would like to have. Plan it ahead of time so that everything can be set for you. There are some homes where you will not be able to have a home birth. So for example, let's say you live in a tower block, which doesn't have a lift, okay? You will not be recommended at all to have a home birth, purely because if in case of an emergency, in order for emergency services to reach your floor, or if they have to transfer you to the hospital and they have to come and move you from your flat to the ambulance or anything like this, it could be a hazardous experience, okay? So it could cause problems, or it may cause delays because you live in a really high-rise building, or not even high-rise, maybe even a 4th floor flat, but there is no lift. So if we have to transport you to an ambulance, or we have to send you down for an emergency of any kind, this might prove really, really dangerous. So there are some restrictions where you will not be offered a home birth because of this one reason. And in that sense, this is where you can think of having maybe a birth center delivery, because birth center is like having, the best of both worlds. You can have a birth in a environment which feels like home, but yet you have access to medication, doctors, and more facilities in case of an emergency. So you have two types of birth centers that may be around you, or you might be aware of, or may not be aware of. But you have a birth center which is considered a standalone birth center. These birth centers are not attached to a hospital. They may be owned by one particular trust, but they are not attached to that trust or that hospital's building. So this is a standalone. They are far away from the hospital. You will still need to be transported by an ambulance, normally on a blue light, if there is an emergency, to take you to a hospital. So it's not just a matter of taking you up to the second floor or the third floor or the ground floor to a doctor's led unit. So it's a standalone, you have to be transported. And this has to be, in order for you to give birth at this place, you need to be very, very, very low risk. It's the same like being at home. Okay. So your home, of course, is not attached to a hospital. So in terms of being low risk, you have to be super low risk. Everything needs to be textbook material, and we're not anticipating any problems or any concerns. Saying that, of course, we're not guaranteeing that because you're super low risk, nothing could go wrong. It's not, that's not what I'm saying. Okay, so on paper, you need to be low risk. If you're going to a standalone birth center, again, you have to be very low risk, as though you were having your baby at home. The other option for a birth center is a co-located birth center. These birth centers are located inside the hospital itself. So for example, where I work, we have a birth center in a hospital. The birth center is located on the first floor, and the delivery suite, which is the doctor's led unit, is located on the third floor. In order for you to go to a hospital that is a co-located, some of the risk factors may be a little bit relaxed because you are much more closer to the doctors if in case of an emergency. So for example, if you have a condition such as a group B strep, right, which is a bacteria where, we do not want this bacteria to pass to your baby during labor, and you may need to be given, or you will need to be given antibiotics before you are delivering your baby. So if you have this, they will not allow you to, or they will not recommend for you to have a home birth, because you need to be given this antibiotics before you are, delivering or pushing your baby out. But you will be entitled to give birth in a co-located birth center, because you can be given the antibiotics on a doctor's led unit, and then you'll be transferred back to the birth center in order for you to carry on with your labor and deliver. Okay. But you will not be advised to have a home birth, because you cannot be given this IV infusion at home, but you can be given it on the ward. And once they give it on the ward, they're not going to then send you back home to deliver your baby. So if you are in a co-located birth center, they can give you the drip on a doctor's led unit, and then you get transferred, let's say, to the first floor in my trust, my hospital, for you to continue with your labor. Okay, so if you are planning to have a co-located birth center, the risk factors that you may have is much more reduced. Okay, they will allow you to have certain risks in order to where you will not be allowed to have a home birth, but they will let you have a birth in a birth center that is co-located. The same thing for a birth center that is not co-located but is away from the hospital. You will not be allowed to do this kind of delivery where you have a drip in a hospital and be transferred back to the birth center. So you need to figure out what your trust that you want to deliver in has, what your risks are of your pregnancy, and that will help you to determine where will be the best option for you to have a baby. So in order for you to be having your baby in a co-located birth center, you may have some risks that will not be allowed to have a baby at home, but it will be allowed to have a baby in a co-located birth center. In a birth center, in terms of pain relief, you will have a bit more, it's almost the same as having your baby at home, because you can have gas and air, you can have the water as pain relief, you can also have your TENS machine attached to the back of you to use as pain relief. You are more or less feeling like you are at home, because a birth center is very, very different to a hospital doctor's led unit. It's much more quieter, is more less noisy. You are in a much bigger room, a much nicer environment. You're able to use things like aromatherapy in a birth center, which you can do as well at home. You can have your partner stay with you. Your partner will be more comfortable because normally in a birth center, your beds are double beds. So your partner can sleep in the bed with you whilst your baby's in a cot next to you. So it's a more nicer, relaxed environment where you are not feeling like, you have to worry about noise from other, laboring women. There's normally not much of anything such as like a real alarm bells ringing where you have to, you hear, midwives running for emergencies or doctors being called for emergencies and things like that. Okay. So please, if you are planning your location for birth, do look into birth centers, co-located birth center, and of course the standalone birth center, because they are two different things. And the risks and your availability to having these things will depend on the kind of labor that the pregnancy that you are having. Okay. When it comes to delivering on a hospital delivery suite, you can also have a baby in a delivery suite where you are quite low risk with no concerns for you or baby, but you may just feel like you prefer to be in a ward or a center where there are doctors or there are easy access to doctors, and you feel more comfortable or confident to have doctors around. You also would like to have a pain relief stronger than gas and air or your injection. Sorry, one thing I didn't mention was that in a birth center or at home, the other pain relief you can have is the opiate injections, which are quite much more stronger than gas and air, but not as strong as your epidural. Okay, you are going to be able to have this pain relief for your labor if you were delivering at home or if you were delivering in a birth center, and that's either a co-located birth center or a standalone birth center. So please make sure that you understand that. If you are the mom that really wants to have an epidural during your labor, then of course the only birthplace suitable for that will be to deliver in a hospital with your doctors around, your anesthetist. So this will be your doctors led unit. Okay, so this is your labor ward, your labor room, labor and delivery, whatever you call it in your place where you are living. You will need to be in an area where there's doctors around you. There are of course midwives as well, but you will have your anesthetist on standby if you need them because you're planning to have an epidural. Sometimes you have to bear in mind that you may request to have an epidural, but the anesthetist might not be available straight away. When you are in a delivery suite, always the priority will go to any emergencies. So if you're there in labor and you request to have an epidural, if there isn't an anesthetist ready or available because they are caught up in an emergency cesarean section, or they are caught up in any type of an emergency regarding somebody else in labor who are more advanced than you, for example, they will have to prioritize that first. That person will be a priority. So if you are in a delivery suite and you're asking for an epidural, please remember that it may not happen straight away. Sometimes you have to wait even up to an hour, up to 2 hours if there is no anesthetist because they are caught up in an emergency in theaters. Okay, so remember, if you are low risk, you can still deliver in a labor ward, and this is absolutely fine. Even if you didn't want to have an epidural, you can still deliver in a delivery suite. Okay, anybody that books with the hospital, we are already considering you to be having a baby in the delivery suite. So later on in pregnancy, when you get around your 34th week, when we're asking you, where have you decided to give birth? At this point, hopefully you've had some sort of a birth preparation class where they've spoken to you about birth plays, the negatives, the positives, all the side effects, the risks, and all of that involved in choosing where to deliver. You may have already had this information, so it will help you to decide by 34 weeks. If you haven't already had a class or you don't plan to do a class, then please do make sure that you are doing this research for yourself so that you'll be more informed to make this decision, okay? Because you don't want to go to a birth center when you know you would like to have an epidural, okay? It's not going to be an experience where you're going to enjoy when you are asking for an epidural and they're saying to you, oh, hold on a moment, don't worry, let's keep going, because this is what they do in birth center. We will encourage you to go and, let your body and your mind do what is meant to do or what it can do, and will really motivate you to keep going a natural route without any epidural in a birth center. So if you know within yourself that, you know what, I don't know what to expect, I would like to have a pain relief because as strong as an epidural, because I'm not good with pain, then please make sure that you are choosing to deliver in a delivery suite. There is no right way or wrong way about it. If you felt like, you know, it's your first baby and therefore you feel more comfortable being in a delivery suite, then please, this is the best place for you, because when you are in labor, the worst thing you can do is to feel stressed, is to feel nervous, to feel worried. This is going to hinder your progress. So choose and go where you feel you're going to be more comfortable, where you feel you're going to feel more relaxed, where you feel more, you know, supported, and therefore you're not going to affect your own labor. So when you are choosing where to give birth, it's very important that you really get to know how you feel. There's no point, you know, thinking that you are choosing where to give birth because somebody told you to do it, or your friends have done it, so you're going to do it as well, or your parents or your mother's done it and you're going to do the same. Somebody's telling you, oh, choose it because I had a really good experience there, but you know deep down you don't feel comfortable with going to a birth center. Don't choose where you're going based on other people's experiences, okay? Or don't say, I'm not going to the labor ward because people have horrendous experiences there, or my sister had a terrible birth, so I'm going to go to a birth center. If you know you would like to have an epidural, or you would rather be near doctors, you want access to doctors really quickly, then choose that location. Don't choose anything based on somebody else's experience, because you're going to have a horrible experience and then you blame it on the person. You know, you can't choose where you're going to deliver your baby based on somebody else's experience. Sometimes, even when you've had a baby in, let's say, a birth center previously, and you want to go again, you may feel like, you know what, I'll prefer to go to the hospital because of my experience with the birth center the first time wasn't great, or I felt like I could have done better, or I would have felt more relaxed if I was in a delivery suite. Then do that. You know, so even your choices in yourself might differ from the first time to your second time to your third time. Some people have a hospital delivery room birth for their first baby, and then the second time round they'll say, okay, I would like to have a birth center because I feel like I can do it. I know what to expect. I'm not so worried. I'm not so nervous. I'm not so anxious. So I prefer to do a birth center, and that's okay as well. So whatever you decide to do in terms of choosing where to give birth, number one, the key is to make sure that you've done your research. Number two, make sure that you look deep down and see how you feel yourself, okay? If you know yourself that I'm not good with pain, like for me, I know myself, I'm not good with pain. I can't handle pain, and I would like to have some good, strong pain relief if I'm going to have a baby. Don't bother yourself choosing a birth center. Don't bother yourself saying, I'm going to have a home birth, or I'm just going to give it a try and see how it goes. There's no wrong way of doing it. Nobody's giving you an award for doing one way or the other. So just choose what fits for you and your family. And as long as you have, of course, you have a healthy baby delivered, you are well and healthy yourself at the end of it, is what you are looking for. Okay, so please make sure that you are looking and researching into your place of birth. If you have any questions regarding this, please make sure you pop it in the description box later, or in the comments box below, and I'll be more than happy to explain it for you later or reply to it for you. I'm going to be trying to do more lives to answer questions and to do more videos regarding all things pregnancy, birth, and beyond. So if you like this information, then please do subscribe to the channel, and also like the video, and be sure to come back to watch the next video as well. Hope you enjoyed this live, and I will see you in the next one. Take care, guys. Bye-bye.